I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. My guest today is Brian Connery with Improve on Health. Welcome, Brian.
Thank you, Craig.
So, Brian, tell us what you do in the field.
Yeah, so I am our Vice President of Sales with Improve on Health. We are an EMAR, Electronic Medication Administration Record, and we're really focused on reduction of errors and simplifying the med pass for DSPs.
So there's a lot of things in there. So med passes for DSPs. Let's talk about that for a second. So we're talking about direct support professionals who assist someone or help someone take their medications, right?
That's correct.
Okay, and then we're talking about an EMAR, which, as you said, is an electronic medication administration record. So that's basically documenting the medication has been given or whatever the situation is, right?
That's correct. Yep.
Okay, so how does your service work?
Yeah, so it works in a really, really unique way. So when you think of like a standard EMAR, what you think of traditionally in this industry, well, let's back up a little bit. There's kind of two ways we do this in the industry. Most of the industry is still on paper. So they are documenting on paper, which is a very error-prone system.
Sure.
And then the other way that a majority of the software providers are supporting provider agencies in the space is with an EMAR, where we are giving you kind of this like record-keeping system that can be complex to navigate. So our founding story has really guided the way we think about being an EMAR in our product development. And our founder, Justin Amoyle, he had lost his brother to an overdose in a supported living setting. So for us, it's really critical to consider all aspects of med management, not just the record-keeping side of that, but the storage systems. How do we interface with pharmacies? How do we actually proactively alert and guide DSPs through a really complex medication administration process, but keep it really simple because they are not nurses. I'm a former DSP. I made plenty of errors, and it sometimes feels very punitive, the med management process. And so we want to make that really just almost error-proof.
So error-proof, make it safe, make it efficient, make it easy for people to use so that people get their meds when they're supposed to, with all the rights, the right time, the right place, the right dose, so on and so forth.
That's right.
So you have the electronic medication record, but you also have some physical things that are a part of this system, right? So how does that all work?
So when we think of med management holistically, right, we think of, we're the only EMAR that's thinking about, well, how do you store those meds? So we have a hardware device. It is we call it the med box, and it actually connects to our EMAR, to the app that guides those DSPs. There's 4 drawers. So from the top to bottom, it is based on time. Your top drawer is your morning, all the way down to your PM meds. And when you're going through your administrations, if it's a morning med pass, it's only going to unlock the right drawer at the right time for the right person. So now we're automatically preventing things like wrong med, wrong time, wrong med, wrong person errors, by also considering, well, how do we safely and securely store those meds?
Yep, and it gets documented
in real time.
In real time, yeah. So that's pretty nice, pretty efficient. I bet people who use it like it.
People love it. We've grown significantly, and it's been like an absolute pleasure just to see like the journey, because part of our philosophy is we don't just build for, we build with. So everything in our entire platform is built on the advice of this industry. It is not built by our team who thinks we know what to do. We actually rely on people like you and provider agencies to tell us these are the challenges that we have and this is what we think could help us. And then we take that info and we go and our engineers build it all.
It sounds like a great partnership between the users and then the company that's building it.
Yeah.
All right, let's shift gears a little bit. You said something that piqued my interest. Let's talk about Brian for a second. You said you started as a DSP. Mm-hmm. Take us back.
So yeah, funny story. I think moms are always right. I'll start by saying that, right? Moms are always right, so shout out to my mom. I was in college. I had a roommate whose dad owned a trade show company. So I was working there in sales, and my mom, I wasn't loving it. My mom was like, you grew up, you were the president of Best Buddies in high school, you've always kind of been in and around the field. This provider agency, the Northeast Arc in Massachusetts, is hiring. And I was like, I don't really want to do that. Apply to the job. Day one, I go there and I absolutely fall in love with it. And so the way I think of the industry is like kind of two mindsets. It's either you stumble into this by accident and then you can't leave, and that's who I am, or maybe you have a sibling or a loved one who's there and that's why you're invested. But
I agree with you. I say those things all the time, and I kind of fell into the system as well, and that was my entry in.
Yeah.
So started off as a direct support professional.
Started off as a direct support professional and then transitioned into, in Massachusetts we call it individual home support. Some states call it individual supports, where an individual is living, whether it's on their own or with mom and dad. And so I managed that program for about a year, and then I transitioned to be a day program director. Did that for probably 4 years. And then ultimately I worked for the state of Massachusetts for the Department of Developmental Services as a service coordinator, for about 6-ish years, where I was an autism service coordinator, support broker for people who were self-directing their services, and a transition service coordinator. So did a whole lot, and then I ended up meeting a company and have been in the vendor space now for about the last 5.
So one of the reasons I do this podcast is to help people see this field as a place where you can have a viable career, and it's more than just like a job. Would you say that that is the case, that this is a great field to work in, and that there are lots of benefits besides just a paycheck?
Oh yeah. So I would say, I think I was talking to a provider at dinner about this last night. So one way to look at it is there's a ton of opportunity for growth within the industry, but I think the more rewarding side of this is the people that are involved, from the people we all support, people with IDD, to the amazing kind of staff at provider agencies, to the state. And I don't think I could ever work in an industry that was not IDD. It's just such a familial type of environment, and you don't get that in like corporate. And this to me is just, it's the most meaningful work that I've ever done, and I can't see myself doing anything else.
I have to agree with you on that. It's certainly the people that we are all supporting are great to know, and I've learned as much from them as I think I've ever provided to them. But just the people that work in this industry. I mean, we've gotten to know each other. There's so many people that we're friends, friends that have kind of a similar mindset, like to enjoy things, but also love to do work that really impacts positively in the lives of others. So it's good all the way around. It's
extremely rewarding.
Yeah. I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So one of the things that I always ask guests are to give me 3 things that you think are that would be impactful to improving supports and services or health and wellness for people with intellectual and developmental disabilities. So 3 tips, 3 words of wisdom, 3 things that you've kind of learned along the way that you would like to share with everyone.
All right. Way to put me on the spot.
That's my job.
So first and foremost, I think the word innovate comes to mind. I think access to technology for individuals is critical, right? And that's where we have this person-centered approach. so that individuals who typically haven't had access to technology that you and I can just buy off the shelf have an easier way to get it. And sometimes it's really difficult to actually, through states and waivers, I think we're all learning together of like, how do we make this a little bit more attainable for people so that they can actually reduce the level of care that they need and become more independent.
So using like supports, remote supports, assistive technology to help people have more independence.
Correct.
Yeah.
And then I think the other part of that is technology at the provider level. So how do we make it easy for providers to get technology that supports their DSPs so that the DSPs, maybe we can reduce the turnover and we can retain great staff by simplifying their jobs. Being a DSP from experience is extremely difficult. And if we can do anything to make that easier, we need to. And then second to innovation, I think, is reducing silos. And why I say that is there are so many amazing technology vendors, there are amazing EHR companies, EMAR companies, but with disparate systems comes disparate data, right? Like we can't actually improve health outcomes if we all don't work together. And so I think we need to innovate, but we also need to collaborate, which we do that, right?
I like that. We do that.
We do that. But I do think it's industry-wide that has to be the mindset it's too hard for a provider agency to use every system that could potentially benefit them. So our data needs to be shared, and we all have to be open to that because that's the only way we can actually improve health outcomes together.
I completely agree, and I think there are so many systems out there that have that have been built to do very good and important and helpful things, but that disconnect sometimes is a bit of a challenge. So the more we can do to make things interoperable, to work together, to take the best of what everybody's done and have them all work together, the better off we'll be.
Yeah, and then lastly, a third one, I would say, it's kind of like a combination between educate and like a shared sense of responsibility. So we all need to educate, continue to learn, right? And I don't mean just you go out on stage because you do a lot of education. It's like we all need to be invested in educating ourselves on new technology, on diagnoses, on how do we support people, on how do we reduce polypharmacy, all these really critical things. And we can't just assume that the data we have today is like the way that the track we need to continue down. And then shared responsibility, I think, goes back to like the reducing silos a little bit, where we all have this shared responsibility as vendors, as providers, as individuals to continue that education, to continue to collaborate, because unfortunately IDD, like sometimes this market, we're 20 years behind others. And without like a shared responsibility of advocating for this population, like and having people like you and Nanette and all these like Kathy Browns of the world, right? And I'm forgetting lots of names, so all those people out there, but without that advocacy and the younger generations like stepping up to also continue the work that you guys have done, I think we will lose a lot of like momentum. So we need people to step up and do that.
Thank you, Brian, for sharing all of that. And by the way, we're coming from an educational event here for nurses, the Developmental Disabilities Nurses Association Conference in Baltimore, Maryland. So if you're a nurse out there and you're looking to learn more about this field, or you work in this field and need some support, this organization is a great organization to be a part of. Brian, thank you so much for sharing your insights today, and more importantly, for the incredible work that you do in this field.
Amazing. Thank you for having me, Craig.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.